Good afternoon, student. Today we start with our lecture of surgery with the orthopedic. In that we have studied in the yesterday's lecture about the general principles of the fracture, and from today we will study about other important points in the fracture. In that, firstly, we will study about the fracture management by open reduction, that is operative management. As mentioned earlier, open method is indicated was the conservative method fail, and when there are specific indications, these indications could be absolute, relative, or rare as mentioned below. In that indication, firstly, the absolute indications, that first one is a failed close reduction. When close reduction is failed, then there is a requirement of the open reduction, that is operative management. When there is a displaced intra-articular fracture, intra-articular fracture when displaced, it also require a open reduction. Then type 3 and 4 epiphyseal injuries and major avulsion fracture, non-union and replantation of the extremities. So all these required a open reduction, that is operative management. Then relative indication. In that, when there are multiple fractures, delayed union, loss of reduction, pathological fractures, for better nursing care and to avoid a prolonged bed rest with closed methods ineffective in Gallagher fracture, Montague fracture and femoral neck fracture. So relative indications are when where the open reduction is required are multiple fractures. When there are multiple fracture with delayed union or loss of reduction, or when pathological fracture, in that patient already suffer from one disease which leads to the fracture, this is called as a pathological fracture. Then for the better nursing care and to avoid a prolonged bed rest, open reduction is helpful. Then questionable indication. When there is a neurovascular injury, open fractures, cosmetic region, or economic consideration, then in that case, questionable indications are present in open reduction. Then method of open reduction is after exposure, the fracture is reduced by direct methods, and in the indirect methods of fracture is reduced without exposing by positioning and traction over the fracture tablets, skeletal traction, tensioner, laminar spiral, etc. So the principle of the open reduction known after the Lamberti is principles of open reduction are suggested by Lam. Lamberti includes firstly exposure. The fracture is adequately exposed through a proper approach. Then reduction of a fracture fragment under direct vision is carried out. Then temporary stabilization of the fracture fragment by K-wire is done first if necessary. So by using a K-wire, temporary stabilization of fracture fragment is firstly done. Then definitive stabilization of fracture using a plate and screw or intramedullary nail, etc. is done later. Firstly, K-wire is used for temporary stabilization, and then plate and screw or intramedullary nail used for definitive stabilization of the fracture. Then retention after open reduction. After the open reduction, the fracture fragment invariably needs to be fixed internally by various implants. So, after the open reduction, when there is an open reduction, the fracture fragment invariably need to be fixed internally by various implants. So, it is that after open reduction, when open reduction is done, the fracture fragment is need to be fixed by internally. So, it require implants. So, the choice of implants are as follows. There are the various choice of implants. Firstly, the K-wire. K-wire for the epiphyseal injury and for fractures of small bones of hand and feet. That is, diameter of K-wire varies from 1 to 3 mm. So K-wire is a primary and it is required for epiphyseal injury and for fractures of the small bone of the hand and feet. Then screw. So for the avulsion fractures and butterfly fragments, screw are used. Inter Intramedullary nails. For the fracture through the narrowest portion of a medullary canal of long bone. So in the case of the long bone of medullary canal, the narrowest portion require a intramedullary nail. Then plates and screws. So for the proximal and the distal third fracture of a long bone required a plate and the screw. Remember, these are very important topic clinically. It is important in our practice and also it is important in the vivals. So the plate and the screw for the proximal and the distal third fracture of a long bone. For the long bone, plate and screw are required in the proximal and distal third. Interlocking nail. For segmental fractures, comminuted fracture, etc. of the long bone. So, for the long bone, segmental fractures require interlocking nail. Then, hip implant. So, for the fracture neck femur neck fracture require a hip implant. Smith-Peterson's nail, Richards compression screw, multiple cannulated screw, etc. are some of the examples. Then spine implant, Steffi plate and screws, lacquer rod, Herschel frame, Harrington's rod are important for the spine implant. Then steel wire. So number 18 to 20 gauze useful for tension band writing for the fracture of patella and olecranon. So the fracture of the olecranon and patella requires steel wire and for Harrington's rod that is Steffi plate, screw, liquid rod and Hershey frame it is required a spine implant and in case of the femur neck fracture hip implant is necessary. And for the long bone, interlocking nails are useful. And for the proximal and distal third fracture of a long bone, plate and screws are useful. Then, for the narrow portion of the medullary canal of long bone, intramedullary nails are indicated. And for the avulsion fractures and the butterfly fragment, screw are used. And for the epiphyseal injury and for the fractures of the small bone of hand and feet, K-wire is useful. Then, the rehabilitation process is the same as for close management of the fracture. Contraindication for the open reduction. Open reduction is not indicated in the case of infection, small fragments, weak and porotic bone, soft tissue damage, undisplaced or impacted fracture, and poor general and medical condition. So, when there is some infection or small fragment or a weak and porotic bone or a soft tissue damage or undisplaced or impacted fracture, but the poor general and medical conditions are present, then these are the contraindicated to the open reduction. This is also helpful in a clinical and oral question. It is important in clinical point of view that when we are taking a decision of what are the indications of open reduction and the contraindication of for open reduction, that in which case of the fracture we can use what method. Then disadvantage of open reduction. When the closure fracture converted into an open fracture and the fracture hematoma is disturbed and scar tissue, anesthetic problems and foreign body reaction due to the metal. So, with the advantage of open reduction, there is also some disadvantages like closed fracture converted into an open fracture and fracture hematoma may be is distant. So there is this maybe formation of the scar tissue. There is some anesthetic problem and in some patient there is a foreign body reaction due to the use of the metals in case of the open reduction. So remember success by open reduction is depend upon the proper indication. When there is a proper indication of the open reduction, then only use open reduction in the case of the fracture. In the proper timing with a proper surgical approach and proper technique and selection of a proper implant with a proper active surgeon. So these are the very important points in the success by the open reduction which depend on. Then quick fact about the methods of the fracture immobilization, that externally plaster of Paris, that is POP, external fixator is used. Then internally fixation with the plate and screw, rod, K-wire, etc. So internally there is a plate, screw, rod or K-wire fixation is useful. Then traction by the skin and skeletal traction. So the next topic is open fractures. Open fracture is a surgical emergency and present as a problem that is much more difficult than the closed fracture. And it is defined as a fracture which, hello, हाँ बोला, हो बोलते, काय झाले, पेशंट आहे का, काय झालंय, बरं अजून काय होतंय, बरं ठीक आहे, म्हणजे काही इमर्जन्सी नाही ना, बरं बरं ठीक आहे, मग 5 वाजता आहे का, बरोबर, तुम्ही कुठे राहतात, हा हा सोनाली मस्कर ते मागे हे DNC केली होती बरोबर आहे, अबॉर्ट झालेलं बेबी, हा 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 आलं माझ्या लक्षात, कशी आहे आता तब्येत, हा ओके ओके, तर ठीक आहे ना, तुम्ही मला येऊन भेटा ना 5 वाजता, आहे मी क्लिनिकमध्ये, ठीक आहे, असेल तर घेऊन या ना, तुमच्याकडे जे रिपोर्ट असतील ना ते घेऊन या, ठीक आहे मी, या ना, सोबत कोणाला तरी घेऊन या, हो हो ठीक आहे चालेल, आहे मी, हो वेलकम. Open fracture. Okay. Open fracture is a surgical emergency and present as a problem that is much more difficult than closed fracture. So, it is defined as a fracture which communicates with the external atmosphere due to the break in the soft tissue cover. The break in the soft tissue could be from inside to the outside or from outside to the inside. So, when there is an open fracture, that fracture is exposed to the external atmosphere due to the break in the soft tissue. And the break in the soft tissue could be from inside to outside or from outside to inside. Then there is a classification of open fracture is that type 1, that is wound is less than 1 centimeter in size and it is usually due to the low velocity trauma. So, when we see the diagram of the variety of the open fractures in that type 1, that is this diagram A. So, wound is less than 1 centimeter in size. In that case, wound is less than 1 centimeter in size and there is usually due to the low velocity trauma. Then type 2, that is wound is more than 1 centimeter and less than 10 centimeter. It is more than 1 and less than 10 centimeter. But there is no devitalization of soft tissue and is associated with very little contamination. These are due to the high energy trauma. So, due to the high energy trauma, type 2, that is more than 1 but less than 10 centimeter open fracture is present as or it is shown in the diagram B, that is type 2 classification. Then type 3, that wound moderate and severe in size, that is more than 10 centimeter and the soft tissue are devitalized and contaminated. So, in the case of the diagram C, that is 3A, in that wound is more than 10 centimeter. So, it is more or more wound and soft tissue devitalized and contaminated. In that type A, extensive soft tissue injury but with adequate soft tissue to cover the fracture bone. In that case, there is an injury of soft tissue extensively, but with adequate soft tissue to cover a fracture bone. So, in that case, there is an adequate soft tissue which cover the fracture bone. But in the D, there is the no covering of the fracture bone. So, that is type 3B. In that case, extensive soft tissue damage and loss, bone cannot cover and is exposed to the atmosphere. So, in the diagram D, we can see that type 3B as there is a open wound and the open fracture is seen. It is exposed to atmosphere with the extensive soft tissue damage and loss. In the type 3, that is compound fracture with arterial injuries, in that as we seen in the diagram, in that case there is a compound fracture with the arterial injury, that is arteries are damaged in the type C. So the no classification invites so much of debate as for open fracture with only 60% of the surgeons across the globe accepting it and hence newer modifications are now being suggested. Then A, that is a modified Gustilio-Anderson classification. Then B, the Tractor's classification. These combine with the Gustilio-Anderson and Sichet classification. C, that is AO classification of the soft tissue injury with alpha numeric classification of the fracture. But mostly there are the open fractures variety are type 1, 2, 3A, 3B and 3C. In that case, there is a fracture is less than 1 centimeter. In B, that is type 2, fracture is more than 2 centimeter but less than 10 centimeter. In the fracture type 3A, fracture is more than 10 centimeter but it is covered by the soft tissue. And in type 3B, that is fracture is open, exposed to the atmosphere, there is a loss of bone and tissue. And in type C, that is type 3C, in that there is a compound fracture with the arterial damage are seen. Who raised the hand? Jyoti, what happened? Any problem, student? Hello. Yes. So we will continue the lecture with the approach in the compound fractures. So compound fractures are usually a serious injury and are due to the high velocity trauma. They may be associated with multi-system and multi-skeletal injuries. The approach should be more cautious and the following protocol is recommended. So, firstly, there is a general physical examination. It is very important when you case taking of the any orthopedic patient. In that, firstly, a general physical examination is necessary. So, this is a vital importance since the patient is usually in shock. There is a level of consciousness, pulse, BP, breathing, etc. should be recorded. It is very essential. Then, examination of the other systems like examination should be carried out for head injury, neck and face injury with the chest injury, blunt injury to the abdomen, pelvic fracture and spine fractures. It is very important to the examination of other system along with the physical examination. Then examination of the compound injury. This is usually proceed in the same line as mentioned in the examination of the closed fracture, but here the assessment of the general physical condition of the patient assume a great importance. And in addition to the usual clinical feature, one should look for soft tissue injury and wound and bone loss, absence of bone pieces, then distal neurovascular status of the limb, etc. So, the term open fracture is more preferable than old out fashioned term that is the compound fracture. So, compound fracture is an old term. So, now the new term is the open fracture. That is, fracture is exposed to the atmosphere. So, this is a new term for the compound fractures. And these are the very important things that is examination of the physicals, then examination of the other systems, and examination of the compound injury is necessary while treating the case of the compound fractures that is open fracture. Then investigation. So general investigation that is a lab test like HB percentage, hemoglobin, blood group, bleeding time, clotting time that is BTCT, HIV, HBsAg, routine urine examination, etc. are